you've reduced your work hours and those employees are down to only working half time, you still have to pay them for the entire week. Now, if they have paid time off through your leave policies, you can fill in with that. If they don't, you still have to pay them. So even if they only work an hour that week, you still have to pay them for the entire week. So I know, a lot of employers have gone to rotating shifts, reduced hours. So just keep that in mind with that. There are a few exceptions to that rule, but they're very specific. Your non-exempt employees, you have to be careful. You have to pay for all hours worked. So if you have employees who are working at home, make sure you track that time, because all time that they spend working is payable. And this can get confusing because when they're home, they might be working a little bit here, taking time off to go help the kids, coming back to work. So you'll have to provide a little bit of training to them on how to do that. So reclassifying employees from exempt to non-exempt, you can do that. You can change them to hourly, but I would be really careful doing that because that can have some unintended consequences down the road. It's really easy to change them from exempt to non-exempt, but it's much harder to change them back. So if you want to do that, really think that through before you do. Also, you can change the job duties of your employees. Just because their job description says that they do something specific doesn't mean they have to always do that. If you are on a partial shutdown, you may not have or you may not have customers that you're taking care of as much, but maybe you have a lot of maintenance that needs to be done, or file maintenance, or it's time to do, you want to do inventory or something like that. You can pull employees in to do those kinds of things. Again, be careful with that with your exempt employees, because you don't want to do something that would jeopardize their exempt status. Their job duties, they still have to meet the job duties requirements for them to be exempt. Some of you know what I'm talking about. If you don't know what I'm talking about and you need to know, you can contact me offline, okay? Because this is just really, this is an overview and to kind of get you thinking about these things. All right. More general HR concerns, discrimination. When you're deciding which employees you need to lay off, which employees you're going to furlough, if you're ready to reduce hours, just be aware of potential discrimination or perceived discrimination. You don't want to make it look like you're targeting a specific group of employees or a specific employee who is in a minority group. And it may end up that is the person who gets laid off, but it needs to be for a business reason. Also remember that employees who are at high risk for COVID-19 could be protected under the ADA. So you don't want to retaliate against any employees if they're concerned about coming to work because of COVID-19 and they decide and they tell you that they need to take time off, they need to not come to work. Just be very careful with that, with discriminating against someone and disciplining employees because of that. This is a time to be flexible, and we'll talk about unemployment and some of those kinds of things as we go, but just keep those kinds of things in mind, because you don't want to give the perception that you are discriminating against someone or targeting someone who could be at risk. There are some OSHA concerns. And first of all, under OSHA's general duty clause, it says that each employer shall furnish to each of his employees employment and a place of employment which are free from recognized hazards that are causing or are likely to cause death or serious physical harm to his employees. Okay, so that's straight out of their wording. So basically, it's your responsibility to make sure your employees have a safe workplace. So that means things like cleaning. It means making sure that if they're working from home. Well, I'll put these next slides up here and we'll just talk through these. Let's talk about cleaning first. Make sure that you're cleaning, that you are cleaning on a regular basis. There's no requirement right now from the CDC to do extra cleaning, but I think it's a good idea, and most employers are trying to be extra careful about this. So, promote good hygiene. When you do clean, make sure you're using the products that will really take care of this virus as far as sanitizing. There are some that are ineffective, and the EPA, on the EPA's website, they actually have a list of approved products for sanitizing. So just be extra vigilant. If your employees are sharing equipment, make sure that you have something there so that they can clean it off between when they come to use it or when they leave. So, and that can be really difficult. And I know some industries, you don't think much about that, in construction industry or landscaping, if you're those kinds of things, if you're doing that kind of work, you're not really, hygiene isn't top on your list, but this is a time to make it top on your list. OSHA record keeping. If you have 10 or more employees and you are in an industry that has to fill out the OSHA 300 form every year to keep track of your work comp incidents, you need to be aware that if an employee is diagnosed with COVID-19, and it is more likely than not, again, OSHA's wording, that they received it at work, that they contracted it at work, then you have to record it. It's a recordable illness on your OSHA 300 form. Now, proving that they actually contracted that at work is not going to be easy to do. They would have to prove that they came to work, didn't go anywhere else, didn't go to the grocery store, didn't walk in anybody else's house. And so that would be difficult to do. But if it's more likely than not, then you have to record it. Working from home, OSHA does not inspect employee workplaces or employee homes if they're working from home. That's not something to be concerned about. But you should make sure your employees have the proper equipment that they need, the proper tools, and you might want to give them guidance on what's ergonomically appropriate and things like that, because even if they are working from home, if they have a work-related incident, then it could still come on your work comp. So just be careful. Make sure when they're working from home, maybe give them some guidance to let them know how to be safe. Now, they probably won't read it, to be all honest. They won't pay a whole lot of attention to it, but if you can prove that you did that and something happens, then that kind of covers you with OSHA. So there are a couple of ways of looking at that. Another question that I've had is if you can take your employee's temperature before they come to work. So in most cases, this would be no, because it's considered a medical examination and the ADA does not allow that. But since this is a pandemic, it is being allowed. And but you have to, when you do that, you want to make sure the person who is taking the temperature is protected as well. Make sure that they have a mask, gloves, whatever PPE that they need to be safe. And what you're looking for is a temperature below, or they should have a temperature below 100.4. Now that sounds high to me, but some people's body temperature runs higher. So if they have a temperature of above 100.4, you should send them home. They should not come back for 72 hours. And if they develop any other symptoms, then they should contact their medical professional. So also then respirators and masks. Should you require your employees to wear them? Unless you are in an industry where it's really high contact with people who could potentially be exposed or be affected, I would say I would recommend no, because if you require your employees to wear respirators and masks, there's a whole lot of stuff you have to do. You have to have a written plan on how they're going to work, how they have to fit. You have to do a fit for duty test. A lot of things, a lot of hoops that you have to jump through. So I wouldn't say that it's a good idea to require it. If they want to voluntarily wear them, you should probably let them. And then what you would do is OSHA's website, there's a list of guidelines for using masks, and you can just make sure that they have a copy of that so that they know what to do. Because if they are using them, they need to use them properly. So the last question here that OSHA has, as far as something that concerns them, can employees refuse to work? And this would be, can they refuse to work because they feel like their job site is unsafe? And so technically no, but if you have a safety hazard, a specific safety hazard that they can point to and say, my job is unsafe because they're not cleaning equipment, because they're not sanitizing enough, because I have to work closely with people and they won't let me wear a mask, those kinds of things, then they have a point. So in that case, what I'll tell you is that the Department of Labor has received numerous phone calls already from employees who say that they have been improperly discharged or improperly disciplined because they have refused to come to work, or other reasons related to COVID-19. And I was watching one of the president's press briefings last week, and the Department of Labor secretary was on there, and he said, I want to be very clear about this. We will investigate all of these, and we will enforce the law. So be very careful to make sure that you are not, that you're providing that safe workplace, that you're not discriminating against employees. And another thing is retaliation. So they're very, with retaliation, the law comes down harder on retaliation almost than it does on the original offense. So by retaliation, I mean, if you have an employee now who's saying, I don't want to work because I'm afraid I'm going to get COVID-19, and then you tell them, okay, but I'm going to remember this later. When you want more hours after this is all over, I'm going to remember this. That could be intimidation. It could be considered retaliation. So you have to be really careful with that. Okay, before we go to the next, Sean, do we have any questions yet?
No.
Okay, all right. I'm going to kind of fly through this. And Sean, if you think I'm going too fast, tell me to slow down. But there's a lot of information here, and I want to make sure we get through it and that we have time for any questions that you might have. So, all right. So the first piece of legislation that came out that really affected employers was actually phase 2 of all of this COVID-19 legislation, and it was the Families First Coronavirus Response Act, or the FFCRA. This is effective April 1st through December, that should say December 31st, 2020. And it applies to schools and government employers of any size, and then private employers with less than 500 employees. Now, that seems a little unfair to a lot of people. It seems a little unfair to me. The thought process there is that employers with more than 500 employees already have policies in place that would cover these kinds of things. But I know for a fact that that's not always the case. But this law applies to employers with less than 500. And it includes damages and penalties for noncompliance and if you unlawfully discharge, discipline, or discriminate against someone. All right, so let's delve into what this is. This has two major parts that will affect you. Well, it has three real parts. One that has to do with health benefits, but in most cases, your health insurer is going to be the one dealing with that. So the things you need to be aware of are what I'm going to talk about here. First is the Expanded Family and Medical Leave Act. And this provides for leave if the employee has a minor child and their school or daycare has closed, or their paid provider is unavailable because of COVID-19. And because of this, the employee can't telework because they need to care for the child. So their kid's out of school, they have to be their child's teacher now, so it's not going to be possible for them to telework because they have to spend so much time with that. There could be a lot of things involved there, a lot of factors. So this allows for a total of 12 weeks of leave. The first 2 weeks are unpaid, so you do not have to pay them. Now, if they have leave available through your normal leave policies, they can use that. So, if they have 10 days of vacation time, they can use that, but you cannot force them to use it. So they can just take those 2 weeks unpaid and save that vacation for later if they want to do that, or they can use it. And then weeks 3 through 12 are paid at 2/3 the regular rate of pay. Okay, so that would all be and for your part-time people, you would just prorate what their average would be. All right, so that is expanded family and medical leave. Now, one thing to remember is that if you are already someone who has to comply with FMLA, if you have 50 or more employees or from a governmental agency and you're already required to provide FMLA, all the other normal rules still apply. This is an addition to it, an additional qualification. But and it adds the payment piece to it, where normally you would not have to pay any FMLA. You just have to allow the time. But it doesn't give them an additional 12 weeks. So all they get is 12 weeks of FMLA altogether. Okay, so if you normally have to comply with FMLA and you have an employee who needs to take time off because of this reason, they get 12 weeks. First 2 weeks are unpaid. Weeks 3 through 12 are paid at 2/3, and then they are out of FMLA for that year. Okay. One other thing about this is that the employee has to be employed there for 30 days. That's another change from normal FMLA. FMLA, they have to be there for at least a year. In this case, they have to be employed for 30 days. All right. Let me look at my notes here and see if I have forgotten anything at that. Oh, weeks 3 through 12 that are paid at 2/3, there is a cap on that. It's capped at $200 per day. So if you have an employee who that 2/3 is more than $200, all you have to pay them is $200. Okay? You can pay them more if you want to, but all you're required is the $200. Okay. The next big part of this is emergency paid sick leave. So there is no required amount of time that the employee has to be employed there. They could have been employed the day before and get sick, and then they qualify for this the next day. This provides for leave for all of these different circumstances. If there is a state or local quarantine or isolation order, so We've had a lot of that right now. So if your business, your business, or not your business, but if your employees are under a quarantine of any kind, then this is something you need to pay attention to. Self-quarantine at the healthcare provider's advice. So maybe you're a high risk, your employee is a high risk individual, or they're having symptoms and they're seeking medical advice. Either of those, if their healthcare provider tells them to self-quarantine, then they fall in this category. Or if they are caring for someone who is subject to a quarantine or an isolation order. So for any of those reasons, it allows for 2 weeks of paid leave at 100%. So if they're full-time, they get 80 hours. And then if they're part-time, it's a 2-week average. Okay. And if they just work variable hours, you go back 6 months and figure out the variable hours and prorate it that way. Okay. The next part of emergency paid leave, for this, you have to pay 2/3 the regular rate of pay. This is if they are caring for a son or daughter whose school or place of care has been closed or whose child care provider is unavailable due to COVID-19. So this allows for 2 weeks of paid leave at 2/3 the regular rate of pay. Now, if you have an employee in this category, they could actually get all 12 weeks paid, because they would be off those first 2 weeks of family medical leave that are unpaid, but they would be paid through emergency paid sick leave. And then weeks 3 through 12, they would be paid under the family and medical leave part at 2/3. Okay?
Amanda
has joined the meeting.
So your employees could actually end up getting paid for that entire 12 weeks at 2/3 the regular rate of pay. All right. So here's the good news. You have to pay all of that, but you can be reimbursed through a tax credit. So this is what you can be reimbursed for. Let me find my place on my notes here. You can be reimbursed for all of the wages that you pay under that regulation, and the costs that you pay to maintain health insurance coverage for your employees during the leave. So if your employees normally pay 20% of health insurance, and you end up picking that up to help them through this, then you can also have that reimbursed. So in order to be reimbursed, you claim the credit on your quarterly 941 form, or the IRS came back later and said you can retain the funds that you would normally pay in payroll taxes. So your part of the payroll taxes. And if that's not sufficient to cover the funds, then you can also receive a direct advance payment by filing IRS Form 7200. Okay. There is an exception to this, and this is good news for those of you with fewer than 50 employees. You can claim an exemption from a portion of this, and it's only from the child care portion of the Act. So if you have an authorized officer of your business that determines any of the following is true. So if providing leave would result in so many expenses and financial obligations that it causes your business to be in jeopardy, or if the absence of employees who went off would be a substantial risk because of their specialized skills, knowledge, or responsibilities, or if allowing leave would leave you with not enough employees to operate at a minimal capacity. So if you have fewer than 50 employees, you can claim an exemption from the child care portion of the Act, okay? Not the sick part, or the quarantine part, only that child care portion that says if your child's school is closed or their daycare is closed. So that means you would not have to provide the family and medical leave 12 weeks of leave. You would, and you would not have to pay that 2/3 of sick leave if it is for child care portion, or if it is for that child care reason. Okay, so I'm going to back up my slides here a minute, I think, so that we can go back here. Okay, this was the emergency family and medical leave. So if you're 50 and under and you are going to claim that credit, you can just strike this page completely. That does not apply to you. Okay, this page does apply to you. Emergency paid sick leave, the quarantine or isolation order, self-quarantine, experiencing symptoms, or caring for someone. That does apply. This page does not apply. Caring for a son or daughter whose school or place of care has been closed. Okay? In order to claim that credit, you don't send anything to the Department of Labor. They don't want it. All you do is retain the documentation at your place of business to substantiate. So you need to substantiate that one of those three reasons is a reason for your business to claim that exemption. And it needs to be an authorized officer, and you'll need documentation to back that up. Okay, one more thing you have to do related to that is there is a poster you need to post, and this is what it looks like, and I have the website here. It is free to download. Do not pay for this poster. There are places online that you can go to, and they're going to charge you $10 for just this poster, or they're going to charge you a lot of money to have this poster combined with a lot of other posters. So this is free. It's just on 8.5 by 11. Just print it out and post it. Okay. So it needed to be posted by April 1st. So you need to post it right away if you have not yet. And it needs to be posted until December 31st. Now, here's an important thing to remember about all this. You know, we may be going back to work soon, but this law is effective until December 31st. So if we go back to work and then you have employees after we go back to work who have these needs or who become sick or need to take care of someone, you still have to comply with this. All right. Another thing is, well, before I go on, a couple of other things I want to mention. If you had already started paying employees before April 1st, I think, you know, we started shutting down toward the end of March. If you were already paying employees before April 1st, that does not count. This law was effective April 1st. So bless your heart for paying them, but you don't get the money back. You can only apply for that credit for whatever you've paid after April 1st. Okay, are there any questions yet, Sean?
No.
Okay. Either I'm going so fast your head is spinning, or everybody's really
You're doing such a great job, Cindy.
okay. I'll look at it that way. One more thing about the FFCRA is if you have not yet complied with this, well, actually two more things. If you have not yet complied with this, there is kind of an amnesty until tomorrow. So you have until tomorrow to fix it. So good thing you're watching this today. Also, this only applies to if you have shut down your business and you're not working at all, that doesn't apply. If you have certain employees that you have completely furloughed, it also does not apply to those employees. Okay, it only applies to employees that you have retained on your payroll. Okay, and also we're going to talk about the Paycheck Protection Act in a few minutes. The Paycheck Protection Program, if you get a loan through that, you cannot use the money from that loan to pay those wages and then turn around and get the tax credit for it. That would be double dipping. So you have to be very careful how you apply all of that. All right, let's go to phase 3 of all of this legislation. and they're currently working on phase 4, so we'll see what comes with that. But phase 3, there's quite a bit there that applies to employers, an expansion of unemployment, the employer retention credits, deferral of payroll tax deposits, paycheck protection program, retirement plan provisions, student loan garnishments, and over-the-counter purchases with your FSAs and HRAs. So let's dig into this. First of all, unemployment expansion. The CARES Act added 13 weeks of unemployment if it is COVID-19 related. So in Indiana, whatever amount that they allow in Indiana, they added 13 weeks to that. So that's going to vary from state to state because each state has its own number of weeks that it allows, and also their own calculations for how much a person receives each week. This also allows for an additional $600 per week for eligible workers from March 29th through July 31st. So only for that time. So if someone was filed for unemployment prior to March 29th, they will not receive the extra $600 prior to that, but it does start on March 29th. This also waives the waiting week for COVID-19 purposes. And states had to opt into that, and Indiana did opt into that. It also will not affect the employer's unemployment insurance rates if it is COVID-19 related. So all of these are things that are funded by the CARES Act. So a couple of things that I want to mention here. If you are, the $600 per week has not started coming yet. All of the states had to revamp their systems, their computer systems, to make these changes, and that's taking a little bit of time. I know Indiana's target date is next week for those $600 week payments to start coming in, and when they do start coming in, they will be retroactive back to March 29th. So those are coming. If you have employees who are partially furloughed, maybe you've reduced wages, or I know some employers are rotating weeks. They have one employee work 1 week, another the next week. There are some things you need to consider with unemployment. If they're partially furloughed, they will still get that $600 per week payment as long as they are eligible to receive any benefits at all during that week. So let's say they're eligible to receive $350 a week. If they're eligible for that, and then you give them work and they make $250 from you, then they're eligible to receive $100 plus the $600. Okay, so even if they only get $1 that week, and if they're eligible for $1, they'll get that dollar plus the $600. So work with your employees. I think at this point, they're not going to feel very favorable to you if you have them work and they make just barely over what they are eligible for, and then that also knocks them out of getting that extra $600. So this is a time to be flexible and try to work with your employees. And then also, if you have employees who are rotating weeks, if they're working 1 week and not the next week, for any week that they go over their eligibility amount, they won't receive anything at all. They won't receive any of their base pay, and they will not receive the $600. So just keep all of that in mind as you work with them. Okay. I don't remember if there was anything else I was going to talk about on that. If anybody has any questions, let me know. Okay, so I'm not going to go into a lot of detail about the financial assistance part. I'm not sure what Scott Underwood is going to talk about next week with all of this, and I don't want to get into his part of this. So the first thing, and a lot of employers are not really aware of this, is that there is an employer retention credit. It's a refundable credit against the employer portion of Social Security tax. So an employer that has COVID-19 related interruptions to their business because of a quarantine order, isolation order, or if their gross receipts declined by 50% compared to the same quarter in the previous calendar year. This is a credit that can be equal to 50% of qualified wages, and that's capped at $5,000 per employee. So there's a lot to it. There's a big formula related with that, but I just wanted you to be aware that it is there and available. However, if you have a PPP loan, you cannot use this credit because it would be double dipping. So, but if you are not getting a PPP loan, this could be an alternative for you. Another thing that you can do is delay of payroll taxes. Now, this is available to all employers, not just employers with less than 500. It's available to all. And you are allowed to defer payments of your employer Social Security tax amounts on tax deposits between March 27th and December 31st. So you would defer your portion of the Social Security tax. Again, that's really just basically an interest-free loan. You would repay that in two installments, 50% by the end of 2021 and 50% by the end of 2022. Okay, and again, if you have a PPP loan, you cannot take this credit, but this is an alternative. So what you need to do is just weigh them all out and figure out what's best for you. The Paycheck Protection Program, which I'm sure I'm sure Scott will go into next week. It's a small business loan, 1% interest, but it's forgivable if you maintain your current levels of staffing and wages. So he will tell you more about the details of that. But I wanted to touch on that and just let you know that those are available to you. Okay, some things that you need to be aware of as an employer that also came out of the CARES Act, and there hasn't been a lot said about some of these, so I wanted to point them out. Employees can have increased access to their retirement plan funds. They can receive a coronavirus-related distribution of up to $100,000. This is available if someone is diagnosed with COVID-19 or if they have a spouse or dependent who's diagnosed and they experienced adverse financial consequences because of it. So it's not subject to the 10% early withdrawal penalty, not penalty. And it can be repaid over a 3-year period. If it's not repaid, then it just is considered income to them. But again, it's not subject to that early withdrawal penalty that you would normally have. There also are provisions in there for increased access to loans through this, where if plans that allow loans, it gives expanded qualifications for those. So if you do any of that, this would require a change to your plan documents. So you need to get with your retirement plan provider and make sure that your plan documents are changed. And then that needs to be distributed to all of your employees. Okay. Another one is employer provided student loan assistance. If you have a student loan tuition a program where you help pay your employees education, this allows employers to pay the principal or interest to any qualified education loan, either directly to the employee or to the lender. It's tax-free to the employee, and the maximum you can pay through this is $5,250, and it has to be paid between March 27th and December 31st. So it's only good until the end of this year, but this can help you. It provides a little bit more of an incentive to your employees. It could be a good retention benefit, so it can help them with getting their education loans paid off. Also, the CARES Act suspended collections of student loans. So if you have employees who have garnishment orders for student loans, you need to suspend those and work with your payroll provider on that to make sure all of that is being done properly. So, okay. The next one, there are some healthcare benefit provisions in addition to the ones that came under the FFCRA that have to do with co-pays being waived for COVID-19 related issues and things like that. These are directly related to HSAs and FSAs. So if you have a health savings account or a flexible spending account, a few years ago under the Affordable Care Act, the ability to purchase over-the-counter drugs and other medicines were taken away if you under your health savings account and your flexible spending account. It only applied to prescriptions, but this gives it back through the end of this year. You can, if you purchase over-the-counter drugs, so if you need Tylenol, Pepto-Bismol, all those kinds of things, you could use your HSA and your FSA funds to pay for those items. And again, this is something that you need to change your plan documents and distribute that to your employees to make sure that they are aware of that. Now, one thing that would be nice is if they would come back and allow us to increase the amount of money that we contributed to those funds this year to allow for that, but that's not in there. Maybe phase 4. So, any questions, Sean?
No, not at this time.
Okay. All right. I wanted to give you some tips for engaging your workforce. We're all working from home, or a lot of us are working from home, and we're trying to figure things out, and your employees are trying to figure things out. They're trying to figure out how they're just going to survive, how they're going to get their kids through this year of school, and how they're going to survive with their spouse home at the same time too. So they have a lot of distractions. So for you as an employer, it's very important for you to communicate more than ever. Make sure they have everything they need to get their work done. Make sure you set clear expectations for what they do from home, but be flexible if you need to be flexible, and just be understanding. This is a time to be kind of considerate. It's not time to come down and be hard-nosed about things. There's a lot of loneliness and isolation that a lot of people are experiencing with this. So anytime that you can encourage collaboration with other coworkers, if you can assign projects that they need to work on together to get them talking to other people and outside of their own little world right now, that would be helpful. Encourage work-life balance, because when you're working from home, it's very easy to be always on. And as a small business owner, I know that for a fact, because I can, a lot of times and some of you on here can attest to this, I've answered calls at 11:30 at night. So I sometimes I have to set boundaries. So help your employees with setting boundaries, and don't expect them to always be on just because they're not there in the office where you can see them. If you have online meetings, and I encourage you to do that, have online meetings through Zoom or other kinds of technology. Allow for some socializing at the beginning of those meetings. You haven't been able to see each other. You haven't been able to catch up. So make sure that they have some time to do that. Use some collaborative technology if you can do that, if it's available. Asana is an app that helps with project management. Slack is a communication tool. Those are some good ones for collaborative efforts. Also, you may need to provide training to your employees on how to telework effectively and how to set up a home office. Some employers have actually asked their employees to send them a picture of their home office, and that's fine if you want to do that. You don't have to. But to send a picture just so you can say, okay, well, it would be better if you have, if you don't have this here, or, just so you can help them to set it up properly. Or so maybe you can see by looking at it what they actually need. Also, if you have an employee assistance program, remind your employees of that. Other benefit programs that you might have that can help them. This is a time to be compassionate. It's a time to be considerate of them. Like I said earlier, they're all trying to just figure it all out. So it's not. They're with the feelings of loneliness that they're experiencing and the always being on. Encourage self-care. Encourage them to take breaks, to take time off to eat a meal, not eat in front of their desk, and get up and take a walk. So even if you don't have something business related to communicate with them about, just send them an email through the day and say, hey, take a break. Have you eaten lunch today? And maybe you can all send pictures to one another of what you had for lunch that day, or what you're doing to take care of yourself. One fun thing to do has been referring to your family members as your coworkers and say, what is your coworker doing right now? Well, my coworker's sleeping on the job, or my coworker's watching daytime TV. So just those kinds of things to kind of help with the camaraderie. And then you need to model best practices. If you don't want your employees to be sending emails at 2:30 in the morning, then you shouldn't be doing it either. Unless you specifically tell them in the beginning, this is when I'm going to be working, and I don't expect you to answer me. So model those best practices to your employees. So the last thing I want to say is the way you handle all of this is the way your employees are going to remember you after this is all over. These are strange times, and it's difficult for everybody. It's difficult for you guys, difficult for your employees and their families. So we're all in this together, and we are going to get through it sometime. It'll be different once we're through it. I don't think things will be the same, but if your employees will remember how you handle this, and if you want loyalty from them, you need to be loyal to them right now. So, okay, that was a lot of information. Are there questions?
All right. Does anyone have any questions for Cindi Kiner? Any questions at all? I haven't seen any show up through the chat yet. I'll give them a couple of seconds here if they have any. Then we'll open it up to our callers. I see that we have a few call-ins, so we'll open that up momentarily.
And while we're waiting, these are some, when this gets emailed to you, you'll have all this information. These are some ways that you can contact me. My email is there. My phone number is there. And I'm going to ask you guys a favor. If you'll go find my YouTube channel and subscribe to it. I'm trying to get more subscribers. So just do me a favor. And once this is all over, I'm going to continue doing YouTube videos on other kinds of HR topics. I have put out 4 videos so far on these kinds of things, and it was questions that people have been asking me. So I'd appreciate that if you guys would do that. So.
All right. There has been no questions through the chat. Any of our call-in users have a question? Feel free to unmute yourself and ask away if you like. But outside of that, we don't have any questions through the chat.
Okay. All right. I talked for a whole hour. So,
All right. Well, just for everyone to know, we have recorded this session, and it will be available on the chamber website in our video library section, as well as the handout will be a link to the handout as well. We want to thank everyone for attending. We thank you, Cindi, from HR Connection, to share with us this valuable information. And again,
okay.
as you mentioned last week, this past time, Scott Underwood will be with us next week. We're looking at titling it "What's Next? Post-COVID-19 Financials." We'll be looking at not only the what the SBA has put out, but also looking forward to opening and seeing how we can maintain financial health. So, with that, I want to thank everybody. And do you have any last words, Cindi, before we depart?
No, just thank everybody. Thank you everybody for coming today, for listening. And if you have questions about anything, if you think of something later, feel free to email me or call me. And Sean, I was going to say that poster that they need to post, the link is there. Do you think you could put that on our resources page, the COVID-19 resources page?
Yes, we can make sure that a link to that poster will be on our news page for COVID-19.
Okay, good. Okay, thank you everybody.
All right, thank you.
Okay.